So this is our Endo Access Kit, and we have 5 different tips in this kit. 2 of them are mainly for preparation of axial walls. Or if there's a patient that really struggles to open and you can't get the head of the handpiece in, you can use these to get in, to find the canals, to de-roof the chamber, or if you just need to have really good visualization when you're doing it. The first 2 tips in the kits are really useful. First one is diamond coated, and the second one is carbide. Then we've got 3 other tips that are going to help to locate canals, remove calcifications, remove the coronal part of GP when we're doing retreatments, cleaning out isthmuses, and getting access to fractured instruments. So we have a bowl one that's going to help with finding canals. And then we've got 2 more accurate tips. So these come to a very pointed tip. So these are going to be a lot more accurate if we're trying to do very precise removal of dentine. So if we're trying to get access to a fractured instrument, if we're trying to remove very narrow dentine in an isthmus, so if we have a distal canal and we've got 2 canals and we've got a very thin isthmus between, we can use these tips to really accurately remove dentine.
My paintbrush things